Alright guys, we're going to talk about defense mechanisms. So these are things that can also affect our therapeutic communications. So defense mechanisms are defined as behaviors that are used to protect the ego from guilt, anxiety, or loss of esteem. A lot of times patients or people don't even know that they are using defense mechanisms. It's often subconscious. It's the body's way of seeking relief from uncomfortable or painful realities. A mentally healthy person uses defense mechanisms to put a problem on hold until sufficient time has passed to permit him or her to address it without unacceptable emotional pain. If we use defense mechanisms excessively, it can be a sign of mental health issues. So let's look at the different types of defense mechanisms. The first one we're going to talk about is compensation. This is a conscious or subconscious overemphasizing of a characteristic to offset a real or imagined deficiency. So a young person whose physical stature keeps them from playing football may compensate by achieving an academic award. So they're compensating for what they can achieve for something that is more obtainable. Denial. Denial is the refusal to accept painful information that is readily apparent to others. This often occurs when patients are diagnosed with things like cancer, or if they're told that someone, a close family member, has died. This is very common, and it's very hard to watch. But eventually the person accepts the information, but it often starts with complete denial of the information. Displacement. This is the subconscious transfer of unacceptable emotions, thoughts, or feelings from oneself to more acceptable external substitute. So a patient who's really angry with the provider, for whatever reason it may be, slams the door as he or she leaves the clinic. So obviously it's not okay to hit anyone because obviously that's not acceptable. But the patient may slam the door, which is transferring that anger from himself to more acceptable external substitute. So that's displacement. Identification. This is an unconscious defense mechanism in which a person assimilates or copies the identifying characteristics, traits, or actions of other people or groups. If you overuse this defense mechanisms, it denies the persons the benefits of self-actualization and their own accomplishments. So they kind of lose their identity within someone else or groups of people. So this is a defense mechanism, but it can also be kind of sad. They lose themselves, they lose their self-actualization. Projection. This is attributing unacceptable desires, impulses, and thoughts to others to avoid acknowledging they are actually this person's own experiences. So, this one's a little hard to wrap your head around, but this is called projection. And so a mother who abuses her own child, they might accuse the medical assistant of being too rough with their child when the medical assistant is performing an assessment on their patient. This may be concealing their own feelings of wanting to hurt their own child. So it's projection of their own wishes, their own unacceptable desires as their own experiences. Rationalization. This is the mind's way of making unacceptable behaviors or events acceptable by devising a rational reason to avoid embarrassment or guilt. This may be used if a patient tells the provider that he or she didn't take their blood pressure medicine because they didn't have enough time before leaving for work. They're trying to rationalize their decisions, although they may be poor decisions. They're trying to rationalize those unacceptable choices. Regression. This is an attempt to withdraw from an unpleasant circumstance by retreating to an earlier, more secure stage of life. This usually occurs when a person feels powerless or desperate. So a toddler may start having accidents at the arrival of a new baby sibling. My son was almost potty trained when I had my daughter, and he definitely did this. He regressed and started having more accidents again. It may even be like an adult using a security blanket again. So even adults can regress back to earlier stages in life. Repression. So different from regression, repression is the mind's way of defending itself from mental trauma by forgetting or wiping things out of your conscious memory. So a child subconsciously forgets to tell their parents that he or she got into trouble at school. So it's not necessarily that they meant to or they were lying. Their subconscious may actually have forgotten to tell them that they got in trouble at school as a way of mentally defending from that trauma. Often patients that have gone through a lot of traumatic experiences, maybe sexual abuse, physical abuse, they may have repressed those memories. Sublimation, the channeling of a socially unacceptable behavior into a socially acceptable behavior. So an overly aggressive person may actually begin playing football to relieve that aggression. So it's more acceptable, right, to get out that aggression on the football field than it may be to tackle someone in public. Suppression. This is the conscious or unconscious attempt to keep threatening material out of the consciousness. So this is a failure to remember. An example is like a failure to remember a significant childhood event, such as the death of a grandmother. So they're going to suppress those memories. Again, can be conscious or subconscious or unconscious in the way that they do this, but suppressing those memories can happen. Undoing. This is acting in ways designed to make amends or to cancel out inappropriate behavior. So the abuser, let's say there's an abusive couple, the person that is abusing the other one may shower the abused person with gifts to compensate for their unacceptable actions. And this is actually a very common cycle, especially in abusive relationships. The person that is doing the abusing will, after hurting the individual, would then make up for it, and they often call it like the honeymoon phase. And so they go back to having a really good relationship for a little bit, then it gets bad again, and the cycle continues. But this is referred to as undoing. So these are examples of defense mechanisms, and keep in mind that these are all barriers to therapeutic communication. So it's important to recognize when patients may be using some of these defense mechanisms and how it may affect your communication with them.